Right now is Dr. Mangla Narasimhan. She's the Senior Vice President for Critical Care Services at Northwell. So obviously we now know President Biden testing positive, having those mild symptoms. You know, we know he's double vaxxed, double boosted. But I guess what we want to first talk about is Paxlovid and obviously taking the president's age, into consideration in all of this.
Yeah, definitely. It's reported that he has mild symptoms, but given his age, he is at high risk for, negative effects of COVID. So the safe thing to do would be to treat him with Paxlovid, which is what he's getting now. The side effects are minimal from the Paxlovid itself. It's bitter taste, and there are some medication interactions. So depending on what other medications he's on, that would have to be taken into account as well.
We do know he takes a statin. Would that be then something I guess he would have to stop taking because of those interactions we know happen?
Yeah, usually we stop a statin temporarily as they take the Paxlovid, and as they come off of it, they can get back on the statin.
All right, so we have heard, including from Dr. Anthony Fauci, about those, Paxlovid rebound. So what would his doctors be looking for during this time?
So about 10% of patients have Paxlovid rebound, and it's basically a return of symptoms day 8 to 10 of after testing positive. So you would expect to see the same symptoms that he's having now would pop up again after resolving. They would come back again during days 8 to 10. So, mild fever most likely and a cough are the most common symptoms.
But even with that rebound, does Paxlovid still keep people out of the hospital? Are those numbers still holding?
They are holding remarkably. Patients who are coming into the hospital are testing positive for COVID incidentally and not coming in for their COVID for the most part. They're having their usual other illnesses and happen to test positive for COVID. So it's definitely keeping patients out of the hospital, out of the intensive care units, off ventilators. It's working to do all of that.
And now monoclonals seem less effective against BA.5, extrapolating that is what he has.
Yes, assuming that's what he has, they're less available and not as effective. So Paxlovid seems to be doing its job, and as long as you can tolerate the Paxlovid, that's definitely would be forgotten right now.
Is pneumonia a concern?
Much less than previous of COVID. We're not seeing as much pneumonia from this. Again, in the elderly, we always worry that they will develop it, but for the most part, we're not seeing a lot of COVID pneumonia.
So what would be your number one concern?
Just other diseases that he may have will get worse during this time period, or that he will develop a secondary infection, a pneumonia on top of the COVID, a bacterial pneumonia. So always looking out for those things and trying to keep his immune system up. Patients of his age have a depressed immune system naturally, so just keeping that in mind and trying to stay out of future trouble.
All right, thank you so much for your time and your clarity on this. We appreciate it.